Hey guys, Dr. Ross here with Denver Grove Chiropractic, and today what we're talking about is things we get to do in our office to help people with something called lower cross syndrome. And a little refresher, lower cross syndrome is where we have our abs and our glutes are very weak, and then our hip flexors and our extensors that run along the spine on our lower back are really tight, and that can change some postural structure with our lower back, and then can start to work its way up and do a ton of different things. But long story short with it, in the office, we want to first evaluate and see, do we actually have lower cross syndrome, and try to prioritize what needs to be strengthened first and what needs to be stretched. But to go along with that, with those muscles being so locked up, the vertebrae and the pelvis can get twisted and rotated and stuck. So evaluating and doing a chiropractic evaluation is very important. We want to make sure the lumbar spine, the vertebrae are moving how they're supposed to, and then also the pelvis is balanced. And there's a few things that we do with that. If we do have some imbalances and some subluxations where those vertebrae aren't moving, the biggest thing that we can do is do a chiropractic adjustment and restore that motion and get things moving. But if we adjust and we don't address the musculature side of things, it's going to take a lot longer, and B, we might not completely solve the problem. So not only is getting the adjustment in that pelvis balance, but we need to make sure we're doing mobility and strength work. And we have a trainer who is really good at working with our patients at getting mobility and strength back where we need it. So a couple things that we do in the office: we'll do the chiropractic evaluation, we'll do a functional movement screen and a mobility screening to see how things are moving, so we can figure out what needs to be strengthened, what needs to be stretched, and what needs to be adjusted. If you guys have any questions when it comes to lower cross syndrome and how we treat it in the office, please comment in the sections below. Otherwise, if you know someone who could use this video, please share it. We love you guys. I hope you have a great day, and we'll see you next time. Thanks.